it's really toxic fast.
It could be good and bad quick.
Baby, I was about to say, check some keep
So I'm not gonna make you learn the level, I'm not gonna make you learn that, but I need you to know that it has a very narrow therapeutic index.
It says 0.8 to 2 milliliters and above 2 milliliters are considered toxic.
Right, but I'm not gonna make you learn the
It's
range.
in the book now.
Alright, if they have signs of toxicity, we're gonna hold the drug, we're probably gonna get some levels, and we're gonna contact the physician. Okay,
And the levels we're looking for is the potassium. And
so we're looking for potassium and also the digoxin level,
the toxic.
okay? Of course, this is everything that I already said, kind of summarizes it for you. We're gonna check that apical pulse for 1 full minute, okay? We're gonna get a baseline rhythm, that's before. Afterwards, should we go back and check it again? Yes, make sure it didn't drop too much, okay? Again, we're always monitoring for signs of toxicity. We're always checking those potassium levels, especially if they're on what? Diuretics. Which one?
Loop.
And thiazide, okay? We wanna teach the patient to check their pulse as well, okay? We may not teach them how to check their apical pulse, because they may not have a stethoscope, but at least they can check the radial pulse and see how fast their heart rate is.
Would they be able to feel it?
Sometimes they can. Sometimes they'll start having like chest pain or have like this just funny feeling in their heart, okay? All right, and sometimes, again, we're always gonna be monitoring their heart rate, okay? Okay, again, those pediatric patients, those dosages are gonna be based on their weight, okay? Breastfeeding is not recommended, okay? Because it's so toxic. Breastfeeding is not recommended, okay? And of course, we know older adults, they're more sensitive to those side effects and toxicity, okay?
When Tina Turner said, "Who needs a heart?" When the heart can be broken, I'm feeling it now.
You feeling it?
I'm feeling it.
All right.
This just sucks.
Okay, again, we use diuretics for heart failure too, right? There's one class of diuretics, we don't have to worry about the potassium being lost. Okay, that's potassium sparing diuretics, okay? Do I want them to eat a whole lot of potassium? No, okay?
They probably eating greens anyway.
They might be. You know, everybody, salad is trending right now, okay? And of course, we already talked about thiazide and loop diuretics. You see how with cardiac medications, it's just the same medications over and over again. All right, so even though it sounds like a lot of chapters, it's the same medication.
It all
over and over
coincides.
again. Yep, because if you think about your heart is a big circle. Like it just does everything over and over again, just repeats itself. Okay? There's another medication that we may use for heart failure, and it's called Nasiratide. Okay? This medication is gonna get rid of their sodium and water. Okay? Why do I wanna get rid of sodium and water from somebody who has heart failure? Fluid, okay? So sometimes when people cannot tolerate like those cardiac glycosides, like the digoxin, because it's so toxic, we'll put them on medications like this, okay? So instead of directly impacting the heart, it's just gonna remove the sodium and water to make it easier for the heart to pump. Make sense? Okay? So anytime I'm losing fluids though, what's gonna happen to my blood pressure? It's gonna drop, okay? So some of the side effects are gonna be related to low blood pressure, dizziness, lightheadedness. They're gonna urinate a lot, right? Because they're losing sodium and water. One adverse effect that may happen though is apnea. What does apnea mean?
Swelling. No, breathing.
They're gonna stop breathing.
Stop breathing?
Yeah, because A means without. All right?
Apnea?
Yeah, like sleep apnea.
Yep.
Okay. Well, we can't help them if that ain't man.
No, we got to, we have to stop it. So think about it, somebody with COPD, would they be on this medication? No, probably not. Somebody that's severely obese, would they be on this medication? Probably not. Okay, those who are at risk for like sleep apnea and those sort of things may not be on this medication, okay? But this is a good medication for those who cannot tolerate digoxin and all those toxicities. Make sense? So of course, we're gonna be checking their heart rate, blood pressure, respiratory rate. Why am I checking their respiratory rate?
They're breathing.
Because they may stop breathing, okay?
Like, does it just happen?
Sometimes, yes. Okay, or sometimes you may see it start trending down, all right? But anytime we go in there, we're checking their respirations, okay?
This scary. Yeah, I'm scared.
Yeah, I never, my thing was never to work on a cardiac flow, it's just too much that can happen quickly, okay? So, the serotype, again, is gonna make them lose sodium and water, so they're gonna be urinating a lot, their blood pressure's gonna drop, okay? The biggest thing I worry about though is apnea, okay, they may stop breathing, okay? There's other medications that may be given for heart failure as well. Have y'all heard of dopamine,
Yeah.
the butamine? Those sound like some heavy hitters, huh?
Dope enough is me.
Yeah, there, yeah. Okay, these are all given IV, okay? And so we give it because I want to make the heart pump better. Anytime I'm giving a medication for the heart IV, it's pretty strong, right? So I need to really be monitoring that heart, okay? What's the best way to monitor a heart?
A heart monitor,
A heart monitor, since they may have a heart monitor on.
a telemonitor.
Mhm.
They make some telemetry calls too.
Boy.
Yes, they do. The little red- They still got the little red phones?
Well, we know we got both phones, we upgraded. Watch out. But they call, baby, and see if they don't answer or the nurses don't get to them rooms at a certain amount of time, they gonna call a code.
Code blue, that was
Yeah,
like
They
new,
gonna call a code.
that was the new rule, but they canceled it because they had too many people putting the patients in the showers and taking their monitors off and not taking the batteries out, so they was calling them left and right, so they had to stop.
You get the right one, my mom gonna call.
So anytime we give in a heart medication, especially IV, we really need to monitor that heart, because it's gonna change it very quickly. Okay? Some of the side effects may be hypertension, increased heart rate, all right? They may start having some dysrhythmias, okay? So although I'm giving this medication for heart failure, what it's gonna do is it's gonna make their heart pump stronger. Because again, in heart failure, their heart's it's not pumping well. So these medications are gonna make it pump strong, it's gonna force it to pump stronger. But sometimes when it forces it to pump stronger, it can throw it out of rhythm. Okay? So we really need to monitor for like hypertension and those abnormal
I
rhythms.
can't breathe,
Okay.
put it down.
So we're gonna be checking the heart rate, the blood
It's
pressure,
just for walking.
okay? Because this IV, I need to be checking the IV site, right? If the IV site not working, can I give this medication? No, all right? If they start having IV pain, I need to assess that pain quickly, because is it still working? Okay? I need them to report chest pain. So if they're getting dopamine, the butamine, milrinone, these IV cardiac medications, and all of a sudden they start having chest pain, what should I do?
Stop
I
the
should stop it.
medication.
Okay, stop it. Okay? So it's not necessarily tested in pregnancy or children. And of course, we know older adults are more likely to get those side effects. Okay? Questions about those IV heart medications? Really gotta watch them. It's gonna make the heart contract stronger. But sometimes because you're forcing it to contract stronger, you can throw it out of rhythm. Okay? If the patient starts complaining of chest pain or difficulty breathing, the first thing we're gonna do is what? Stop it. Okay? And then potassium and magnesium. We talked about potassium a little bit already, right? You got the big horse pills. Sometimes it can be potassium liquid, and then sometimes it's potassium IV. Do I give an IV push, or can anybody give an IV push of potassium? No, it's gonna kill that patient. Okay? We talked about lethal injection, that's the lethal part, it's potassium that kills them. Okay? If we ever give potassium too fast, or give it, as an IV push, it's gonna instantly stop their heart. Okay? Another thing with potassium, it always has to be diluted because it burns. So when they're taking potassium pills, they're gonna have GI upset. When they're drinking potassium liquid, they're gonna have GI upset. When they're getting potassium, they call it potassium riders. Are they getting IV potassium? It burns. So we have to give potassium very slowly.
So the banana bag, is it diluted already?
Yes, banana bag is not like pure potassium, that's like all the electrolytes.
Okay.
Potassium is like a little bag like this, and it's like pure, it's like, it burns.
Is it still yellow? Is it like dark?
No, it's clear.
Clear.
So you can, wait, what? I'm confused. You said, don't give IV?
I can't give it IV push, meaning
Okay.
a syringe and just pushing it.
Okay,
But I
that's
can
what
give
I'm
it-
writing at the same time, okay.
I can give it as an IV, but it's gonna be really slow.
Okay.
Super slow. All right, let's say it's already going slow, the patient like, it burns. What do?
No,
Make it slower.
you're gonna make it slow,
Gonna make it
cause it's
slow.
not
It
gonna
burns.
stop burning.
It's not gonna stop burning.
That's gotta be, you must really need it if it, I don't think I've ever seen a potassium bag.
Mhm.
Yeah, like, we have them all the time on our floor, and the men are the worst patients with them, I
It
swear.
hurts.
They punks.
No, it hurts.
No, it do, but
It hurts.
them men, boy, they gonna cuss, cause they want you to cut it off, they want you to do everything.
How long does Sandy usually, do it through, like, does it just depend each patient?
It does. So most of the time, the reason why people's potassium is low is not because they're not eating enough, it's because they're losing it. So either they're on diuretics for a long time, or strong diuretics, or they have nausea and vomiting, because that's how you lose potassium, vomiting or diarrhea. Okay? So usually because they're losing it. So if you have somebody who has like prolonged diarrhea, we can automatically assume they're gonna need some potassium. We have some HIV patients, whenever they first, become contracted with HIV, they start having like a lot of diarrhea, and we automatically know their potassium's gonna be low. Somebody that's on some severe loop diuretics, we know their potassium's gonna be low. So we have to replenish them with IV, because sometimes the food is not enough, sometimes oral is not enough, we have to give them potassium IV. But again, we have to give it super slow because it burns, okay? If the patient says it burns, guess what? It burns, okay? So we can slow it down. We don't stop it, because they're gonna need it, but we just slow it down as slow as we can, give it.
And when they say it burns, it means it burns going in?
It burns going in.
It burns.
It burns. It's very irritating.
So let me see if I heard this right. You said do not give potassium in an IV push, but you
Correct.
can give it IV drip.
Yes.
Very slow.
Very slowly.
Go ahead.
And it's always diluted, always, always. And we always have to make sure that the IV site is working too. Because if our IV site, if the IV moves, it is no longer in the veins, it's in the skin, guess what's gonna happen to that skin? It's gonna become irritated, it's gonna turn red, it may become necrotic, because potassium is very irritating to tissues, it burns, okay? So before we give potassium, I need to make sure that IV site is working. Does that make sense?
Mhm.
The main thing with IV potassium, it burns, we have to give it slowly, okay? Can I give potassium IV push?
No.
No, not unless you work
You
for
work in a prison, and you the
Yeah.
dead man.
Yeah,
Strap him down.
yeah. Okay? Then there is magnesium. See that the one with the little bonnet on over there? You see her? That's the caboose. So remember I told y'all I had preeclampsia, so my blood pressure was sky high.
That's the one that did you in now.
Oh my gosh,
They see the
yes.
girls be bad, bro.
Oh, but I had 3 girls.
Well, she was the last one, she had the
Was.
bigger
And
entrance.
remember, I was geriatric maternal patient.
See, they called you old, you were just 30 something.
So magnesium is used to help kind of stabilize your blood pressure and stuff, but it makes you feel horrible.
Really?
It makes you feel sick. I can't even describe it. But I
Is it like
feel
too much? Cause I've started, back taking my magnesium vitamins.
So that's a little different.
Okay.
When you get magnesium IV,
Straight up.
they automatically tell you, okay, when you get this, you're gonna start feeling bad. So as soon as they hit, I was like, oh, I couldn't even describe it. It was just a horrible feeling.
Okay.
But it helps your heart with it helps to keep the blood pressure stable. And it also helps the heart to maintain like just a steady, stable awesomeness.
Like just chill.
Yes, but it makes the rest of your body feel awful,
Wow.
just awful, okay? I can't even explain it, just awful. Just awful. Okay? So again, side effects of potassium, a lot of GI upset because it burns. IV potassium, it burns. Do we give it fast?
No.
No, it has to be slow. If it's going slow, they're like, no, it's I can't take it, it burns. What do? It's slow, slow it.
Then they gonna complain about, I'm ready to get off, I gotta go here.
And potassium is one where, well, I gotta go to the bathroom, can you unplug me? No, take it with you.
Yeah,
Oh, they be ready to get
cause you
unhooked.
can't interrupt it.
You don't wanna interrupt that potassium.
Oh, we've had doctors go off.
Oh, yes, because they're giving it, because if they don't, then their heart is going to be all out of rhythm,
Yep.
okay? All out of rhythm, okay? Again, overdose. You know, they say it so nicely on here. It says overdoses can cause life-threatening EKG changes.
You
You
did.
see that?
Right.
You see that?
You got it.
No, overdose will do what? Kill them,
You did.
okay? It will kill them, all right? Never give potassium IV push, okay? Never. So I wonder who, never mind.
No, come on.
I was gonna say, I wonder who pushes potassium. Nurse?
No, I think it'd be like the coppers, the guards and stuff. Oh, no, you know, what, maybe a doctor. Maybe a doctor.
But the doctor has like an oath to do no harm.
What, I ain't doing harm, I'm doing my job. I'm doing my job.
But that's still causing harm.
I'm doing my
I
job.
have to look that up. Who does that?
You don't hear about it too much.
No, I never thought about it before, like, cause nurses know, I'm not gonna do that, I'm gonna kill them. I just,
Somebody gotta do it.
I guess, I don't know.
Lord, how much you get paid?
All right, so anytime we're administering potassium magnesium, because we know it impacts the heart, I wanna monitor the heart. Anytime I monitor the heart, what am I looking at? Blood pressure and heart rate, okay? If we get something IV, I'm monitoring that IV side as well. Make sense? All right, so if they're taking these medications orally, all right, we know that we teach them this because you're losing potassium, or you don't have enough potassium, you don't have enough magnesium, okay? Don't double dose it, okay? Avoid taking potassium on an empty stomach. Why?
It's gonna hurt.
It's already caused so much GI upset, okay? I need them to report signs and symptoms of GI bleeding though, because is that a possibility?
Yeah.
Yes, especially because what? Potassium burns, it's irritating, okay? And they need to keep up their follow-up appointments to monitor those levels, okay? Those who are pregnant and lactating, okay? It has a low to moderate risk of birth defects when they get potassium. And magnesium is safe during pregnancy. Why? Because most of the time when somebody has hypertension and they're pregnant, they're putting them on magnesium. That awful, awful feeling medication, okay? And then we talked about anticoagulants already, right? It's some medications that help prevent clotting, because when your heart's not pumping well, where's that blood going?
One spot.
Nowhere, it's sitting there. Anytime blood sits, what happens? It starts clotting. So they may have to get anticoagulants like heparin, warfarin, or Coumadin, okay? Anytime I give them an anticoagulant though, what do I put them at risk for? Bleeding. So heparin is usually given sub-Q, okay? It's usually given sub-Q. Sometimes it can be given IV if they have like a central line or some type of line that's clogged. Then I'll push the heparin to open it up to unclog it. But most of the time it's given sub-Q, okay? Coumadin or warfarin is always given by mouth, okay? It's always given by mouth. Now there are some times when I may give them too much heparin. Right? If I give them too much, what could happen to the patient? They're gonna be bleeding everywhere. The gums gonna start bleeding. They're gonna have blood in the urine, blood in the stool. They're gonna be bruised everywhere. So there's an antidote. It's called protamine sulfate. Okay? Called protamine sulfate. Alright, so protamine sulfate is the antidote to heparin toxicity, okay? Protamine sulfate is the antidote to heparin toxicity. And heparin is given sub-Q and sometimes IV, right? Warfarin or Coumadin is given by mouth, okay? And if I overdose them or they're taking too much of warfarin or Coumadin, that antidote is vitamin K.
Potassium.
No. So a lot of people get that mixed up because potassium, the sign for potassium is a K with a plus,
Okay,
two different things.
alright.
Alright, so that could be considered like one of those sounding like lookalike medications, because if they're supposed to be getting vitamin K, you give them potassium, that's totally different. Okay, totally different. So the antidote for heparin overdose is protamine sulfate. The antidote for warfarin or Coumadin overdose is vitamin K. Okay,
I'm sorry, can you say the last one again?
the antidote for warfarin or Coumadin
Warfarin, okay.
overdose is vitamin K. Y'all, guess what vitamin K is found in? Which foods? The green leafy vegetables.
That's why I was thinking of potassium.
Right, it's similar, but it's still two different things.
Okay, so what this one here gonna do?
So vitamin K, so y'all have children before, right? Y'all have children.
When
So
you
vitamin
first have
K
them.
helps your blood clot. So whenever a baby is born,
That's what
they'll
they
give
give
them
them, shot in the foot.
IM vitamin K so they can start clotting,
Okay.
okay? So remember, Coumadin is gonna help you not clot so much. So if we give them too much Coumadin and they start to bleed too much, then we have to give them the antidote, which is vitamin K. Alright, so let me give y'all this scenario. Y'all ready for the scenario? Okay. Let's just say that my name is, Rose. And I am like 78 years old. Don't tell me that's old, cause I'm still
Still
Popping.
hitting them.
Still popping.
tut-tut. Okay? And I have heart failure, because my heart doesn't pump well, so sometimes my blood's just sitting there. So they put me on warfarin. And here's the thing, every time I go to my appointments, they keep talking about my Coumadin level is off and my bleeding times is off and the medication's not working. I'm like, I take it every single day like I'm supposed to. So why the medicine not working?
Probably something else that she taking.
What?
She eating too much?
I'm eating the antidote. Oh, so what
Oh.
would you have to ask, Rose?
What do you eat?
Oh, so, okay, so on Sundays, I gotta have, my baked chicken, and I gotta have collard greens with my cornbread. And then on Mondays, it's red bean Monday, so I have my red beans with my barbecue chicken, and I may have, mustard greens this time. And then, on Tuesdays, I wanna do a little salad, but I'm gonna use spinach leaves for my salad.
Who cleaning all these greens?
Rose ain't got no life except me.
So what's the problem? I can't have those green leafy vegetables because it's causing the opposite effect.
You doing too much with the greens, Rose.
But y'all told me that green leafy vegetables got a lot of potassium in it, and potassium is good for you.
But you didn't kill me.
And not in your case,
You done had greens 3 days this week.
Yeah, you gotta have your greens.
Not every day, Rose. Shit.
So here's the thing though, a lot of older adults may be on Coumadin, right? But a lot of older adults, they live by, I have to have my greens.
No, Dr. Dyson. They have to have a bowel movement, girl.
Well, that too.
Girl, they gotta have a bowel movement.
Because think about it, older adults have issues with constipation sometimes, and sometimes, like having a bowel movement is like the best feeling ever. Y'all know
I ain't gonna lie.
backed
I
up.
be thanking God for a good one.
See what I'm saying?
Oh, that shit feel good.
So, if I'm on heparin, then of course I can have green leafy vegetables, but here's the thing. Is a doctor gonna send me home from the hospital on heparin?
No.
No, why? Because it's an injection. Most of the time, if I'm on heparin in the hospital, I wanna start transitioning to Coumadin, which is oral, so you can take it at home. Make sense?
So how often should Rose eat her little greens? Once a week at least?
It depends on what her level is.
Well, look like yours is high.
So, can we tell them completely take it out?
They ain't gonna do it anyway.
It's not gonna work, but they still need some vitamin K.
At least once or twice a week.
I may say once or twice a week,
Oh.
not every day, Rose.
And not large portions.
Not large portions, Rose.
You know them old people could be.
If they take Levinox,
Lovenox, so Lovenox is heparin.
okay.
Lovenox is low
That's the
molecular
baby
weight
shot.
heparin.
Okay.
Remember, heparin is sub-Q and is given in the stomach.
Every time you go-
You said Lovenox is what type of heparin?
It's a low molecular weight heparin, so it's still
Okay.
heparin, it's just not as strong as pure heparin,
Okay.
okay? So, we gotta monitor their bleeding times. So that means we gotta draw their blood and see how fast their blood is able to clot, right? So that's how we know if it's working or not. So if they're on heparin, I am monitoring their APTT. That's the name of the blood draw, it's an APTT. Okay, if they're on heparin, that's what I'm monitoring. If they're on warfarin or Coumadin, I'm monitoring their PT and INR.
What? We had that in the book. Y'all see that? What's the second one?
PT and INR.
That's on Coumadin, right?
Say it again, warfarin or Coumadin.
The PT is the warfarin and Coumadin?
The PT and INR. Okay. APTT is if they're on heparin. PT and INR if they're on warfarin or Coumadin.
Okay, now what do APTT stand for?
It's activated prothrombin time. It just tells you.
Oh, you was
how-
ready for me today, wasn't you?
No, there's some things I know, okay?
Alright, you was ready with that one.
Like NPH, who knows what that is?
And you know I done forgot it, I said I was gonna remember
Ask any
it.
nurse, like, what does NPH stand for? I mean, like, what does that even mean?
I said I was gonna remember it, I still can't now.
Yeah, you said, I was like, oh, that's cute.
With the PCNR for INR?
PT and INR, that's for warfarin or Coumadin,
Okay.
okay? So, the side effects for both of them are the same, right? They're gonna make you bleed. If they just have like bleeding gums, is that a problem?
No,
Not necessarily. They use a soft toothbrush. But if they got blood in their urine, is that a problem?
yes,
If they got blood in the stool, is that a problem?
Yes.
If they got a little bruise here and there, is that a problem? No, that's expected,
Mhm.
okay? If they got a shave, what kind of razor should they use?
electric.
Questions? Questions? No. All right, so let me tell y'all about chapter 18. Let me tell you about chapter 18. Y'all haven't had med surg yet, right?
No,
So here's the thing. Whenever you're in pharmacology, I don't go into detail about antidysrhythmics. The reason why I don't is because there's so many different rhythms, right? You got bradycardia, you got AFib, you got VFib, you got VTAC, you got heart block.
That's why the heart monitors come in.
Yes, and it's so many of them. If I start teaching these medications, are you gonna understand them?
no,
No, because you don't know the heart rhythms, all right? So when you get to your med surg class and they start talking about heart rhythms, that's when you'll learn about the different antidysrhythmic drugs. Does that make sense? But there's one that I do talk about. It's called adenosine, okay? So you can actually, with this chapter, don't even worry about it. It's there for when you need it, for when you get to med surg, okay? But I'm not going into detail about it. Why not?
cause
Y'all
it's,
don't even know the rhythms yet, all right? But just FYI, any antidysrhythmic, guess what a side effect is? It can put you into a bad rhythm, right? So we're giving it to you to fix one thing, but it may put you in a whole different rhythm. Does that make sense? So that's something important to know. All antidysrhythmics can cause another dysrhythmia, okay? There's only one that I'm gonna teach y'all about right now. It is called adenosine.
That's the first word in our term. Ventricle tachycardia.
So that's the only question on the test for chapter 18.
Yes, it's the only one I want you to know. And it's usually used to treat, SVT, but this is it right here, adenosine.
You said
Guess why I
you,
want y'all to know this? This is used only for this one rhythm, SVT. So y'all, remember I told y'all about when my son died, my heart just started doing all this crazy stuff. So I ended up having PVCs, which means my heart was beating before it was supposed to be, and SVTs. So it was beating super fast, and it was beating before my heart was supposed to beat, and then after my heart was supposed to beat.
so it
just-
was beating too fast.
it was bad, okay? So, if we have somebody with this type of rhythm, an SVT, we're gonna give them adenosine. Guess what adenosine is gonna make them do?
Slow down.
It's gonna
Relax.
stop their heart.
Oh, come
It's
on,
gonna
stop
stop it, yes.
You can't
And
be
guess
doing
what,
that.
that's
They
what
say
I
it-
wanted to do,
They say it stops it for a second.
a few seconds.
Yeah.
So y'all ever had a laptop or a TV and it didn't work? And you're like, huh? Or you're like, let me turn it off and turn it back on, see if it works?
Yeah.
This is the medical, turn it off and turn it back on.
The
and then see if
reset,
it works.
reboot.
When we gonna come back on?
So,
It's
that's a whole
For
other
real?
issue.
Isn't that an adverse side effect? Wouldn't that be? Come on now.
That's like the worst case
Then we
scenario.
gonna have to shop, that's something totally different. Alright,
like
but
it's
here,
a toy.
Shit, it is.
somebody
They play
with
with
this
it.
rhythm,
Play with my own
their
emotions.
heart's gonna stop. So the test question may say,
Yeah, like a
the nurse
I
has
thought they put
given
this nurse stuff.
a dose of adenosine.
Say for me.
The patient's heart stopped. What should the nurse do?
Run.
What should the nurse do?
time it,
Monitor.
monitor it.
Wait a few seconds,
Yeah, you time it, monitor it.
because it's gonna start back again. Look at that face.
See what I mean? Just playing with them people.
Freak out. So y'all, sometimes it's that simple. Turn it off, turn it back on, it might work.
It might work.
How long?
One of our patients had that.
It is. I mean,
How long do we have to wait?
it's only a few seconds.
Like 3, cause I need to know. After 5, I'm panicking.
I will be like this.
And after a few seconds, y'all have seen, y'all always wanna quote Grey's Anatomy and all that kind of
I
stuff.
ain't
Not
never
me,
watched
I ain't never
Y'all-
watched it.
I
that's
did.
class.
I ain't know.
Alright, y'all
They
just
they lift the arm so it goes quicker.
And have y'all ever seen on there, that like, they gave medicine and everybody pauses, they're like,
No.
y'all
No.
seen that? And all of a sudden it goes, beep,
I love
beep, and everybody relaxes.
Girl, I wish I
That's
got
always like the dramatic part of the
Girl,
movie.
go watch
Mhm.
Okay?
Grey's Anatomy. We got like 20 something seasons.
You
of
don't
that.
That's like the best part of the whole like ER section.
That's
Give
the
them
realest
medication,
part, huh?
and everything stops, like everybody really pauses.
Y'all so crazy.
Then it's beep, it's every, and y'all be at home like this.
Ooh, yeah.
I think because like his heart was beating so fast and he couldn't handle it, so then they give him this to stop it completely to get back in rhythm.
So again, when you think of adenosine, think of like when your laptop or your TV don't work, turn it off and turn it back on, and you know, see if it works. Okay? All right, this is the only one I want y'all to know.
Okay.
Okay? What is it called?
Super
Killer.
ventricular.
Okay, what is it gonna do?
Reboot the heart.
So the medical term for that is asystole.
Asystole.
Because A means without, and systole means contraction. So if your heart is without a contraction, guess what it is? Or a flat line. It's not contraction, it's not doing that. Okay? Make sense? Questions? All right, when do we give adenosine?
Never for me. I ain't. I'm going to eat. I'm going to lunch.
And what is it gonna do? And it's gonna start back up again. Just think about all those shows that they be watching. Y'all, like literally, everything's pauses. It's always that one doctor just like,
You so
y'all know what I'm talking about.
It is like that.
It is. And y'all literally be at home like,
All
all right?
I just see it the first.
Just die.
Question.
your
let's
vote.
start again.
I said I was.
Yeah, I'm just trying to help y'all remember, that's all. I'm just trying to
That's
help
all
y'all
I got
remember
for the first,
while I entertain
but I
myself.
was super.
This I was looking
All right, somebody was talking about Cheerios or something like that.
Hey, come on,
Somebody was
let's
talking
go.
about Cheerios.
I'm hungry.
This is this chapter, okay?
This one, 18?
One,
18 is only one drug, what is it?
adenosine.
Don't need to know to recheck every 15, 30 minutes, none of that? Just double check. You get a chapter 19 like that too?
No.
I was wondering, cause I only got so many index cards.
I got some more friends.
Yeah. If you get that question wrong on the test, I'm leaving.
She gonna
You
drop
gotta
that.
make that, it can't be no obvious.
Why did I get it wrong?
It can't be that no obvious.
And Dr. Thyssen, don't try to word it for me either.
I'm a word, I told y'all, I'm gonna say asystole. I told y'all that for a reason, that's what I'm not gonna say that, Patient Park's gonna stop.
Wait, but spell that word for me.
A,
Come on.
SYSTOLE.
yes, asystole.
So ACES
Oh,
is
okay, yeah, that
AKA SVT. What, like, what?
The telemetry people.
So asystole, the prefix A means without.
Okay.
Systole or systolic, that means contraction.
So without
that's the
contractions.
Where's SVT?
Oh, that's just the name of the rhythm that it treats.
Oh, okay,
Yeah.
alright, alright.
So without contractions.
Without contraction. Of course, without a contraction is that flat line,
Okay.
right? Y'all better get it right. If y'all don't, I promise y'all.
You gonna quit?
I am.
Don't.
I'm gonna tell
We gonna get it right.
I don't know what happened,
We gonna get it right.
all right? So y'all, high blood lipids, so this is cholesterol, triglycerides, all that kind of
Oh
stuff,
man,
right?
these the ones right here.
Y'all say, "Oh, yeah."
Yes.
Okay.
For real.
So again, I'm not gonna go into the different types of fats, okay? Not gonna go into, cause y'all understand what fat is, right?
No, we ain't learning it in nutrition.
What?
Yes, we are. We got some of them in there.
So here's the thing, if you got too much of it, you
Yeah.
see this? It's gonna start clogging the arteries. And once it's in there, can you pull your artery out and clean it out?
No.
No, once it's in there, it's there. Okay? And usually it takes time to build that up. So usually when y'all are teenagers, when people are teenagers, and we eating all this stuff, and we just think we're invincible, by the time we get my age, which is like right past a teenager,
Smooth.
then you know we have these clogged arteries. And you're like, what happened? Okay? So, and then sometimes it can just be like a hereditary thing.
I was just, because I was gonna ask, because I'm like, when I go to the doctor, I tell them I don't have any hereditary issues because my family eats horrible. Like my dad's side, everybody got high blood pressure, diabetes, but you eat pig feet, you eat all the stuff you shouldn't be eating.
So that's not necessarily hereditary, that's habit.
No, that's why I said. So I'm like, I really couldn't tell the doctor what I know of
Gotcha.
because they eat horrible.
Right.
They really do.
Now, when people have like hereditary like problems with fats and cholesterol, it's because their body's just producing too much.
Yeah.
It don't have nothing to do with like how
It's
much
the
they're
whole family,
eating.
Dr.
It's just
Tyson.
the.
I swear, my dad's side of the family is
Okay.
terrible.
So, and with this type of hyperlipidemia or increased lipids, if it's hereditary, then diet changes is not gonna fix it. Because it's not like you're eating a lot, your body just
It's just in your
produces too much.
genes.
Okay? Now, here's the thing. Before I put somebody on medication for high cholesterol, I want them for 6 months to change their lifestyle.
Yes.
6 months.
It'll work.
Now my
I want them to exercise, I want them to change their diet, increase their fluids, I want them to do all that, decrease the amount of alcohol. And Deja, you heard me? Okay. All right.
That's the wine influence of that.
Not gonna happen. I told the doctor, that's not gonna happen. I can cut a lot of things out, I'm not gonna stop drinking.
Not the liquor. That's liquor.
Liquor, I cut liquor, I'm not gonna stop drinking wine.
Okay, wine's a little different. Is that right, Tiva? Wine is different, yes.
Look at Tiva like,
Because I'm telling you what Tiva does. Mom, you don't need that. You can't have that.
Now my daughter be like, that's the fruity kind? It tastes a little bit. I'm like,
Might as well go get the red top or the brown top.
Okay.
Let me tell y'all why they usually wait for 6 months. Cause these medications for cholesterol are hard on your liver. Like it destroys your liver.
Really?
Yes. So that's why they would rather you change your lifestyle before they put you on these medications.
That's crazy.
Yeah, just about half of our patients are on statins.
What'd you say?
I said half of our patients are on statins. Like
And
this,
that's the main one.
Yeah.
Okay. So here's the thing. Not only can it eat up your liver, it can cause kidney failure.
Girl, just kill me.
It can cause kidney failure. All right?
Every time you talk, I hear, what's the name, Samoa? I don't know if you ever seen us in there. Here come the side effects.
I be wanting to say that so much.
So y'all said statin drugs, right? The actual class is called HMG CoA reductase inhibitors.
What?
So that actually is the enzyme that controls cholesterol.
HMGCOA.
But these are statin drugs like lovastatin, fluvastatin,
Okay.
pravastatin, atorvastatin, are statin drugs. That's what they call statin drugs. Okay? See, we got to weigh the risk and the benefits. But hold that thought. All right. So with statin drugs, we tell them before we put them on these medications, I want them to have a lifestyle change for 6 months. If it doesn't work, then we put them on here. It's harsh on the liver. Okay. If the patient starts complaining of muscle pain, then they need to contact the doctor. You know why?
Because of those drugs?
Right, because statins, if the statins are causing that muscle pain, it's actually it's a condition called rhabdomyolysis. And in that condition, it releases a protein that tears up your kidneys.
Now, everybody in here did what you call a study for Mr. Dane on rhabdo. So we did. Everybody had to write a thing on it. For extra credit.
Oh yeah, with the muscle thing.
Yeah, for rhabdo. I turned mine in.
Yeah, I had to do it.
Yeah.
All right, so the way statins work is they're going to reduce cholesterol because again, it's going to stop the enzyme that produces cholesterol. Guess what time of day they gotta take it though? At nighttime. Why are they taking it at night? Because that's when cholesterol is produced.
Oh,
At
okay.
nighttime. Right, so around 7 o'clock p.m. is when they should take it. Okay, because again, how this medication works, it stops cholesterol production. So when should they take it? Whenever cholesterol is produced, which is when? At nighttime. All right. What's the side effects? Is what is it hard on? Your liver. And if they start complaining of muscle pain, should I say, oh, don't worry about that. That's just this.
No, immediately.
And they need to contact the doctor because that means they have rhabdomyolysis, and that leads to kidney failure.
so it's stopping the production of that, or is it lowering what?
The risk of it.
So it's the HMG-CoA reductase inhibitor. So that's the enzyme that controls cholesterol production.
Right.
So it's basically stopping that enzyme from working. Is it going to stop it all the way? No. But it's going to stop it enough to where it's going to lower the amount of cholesterol that your body is making. That makes sense? And it's best taken when cholesterol is produced.
Why is it produced at night?
Now see, that is outside of my scope. We gotta ask.
I didn't know. Well, I didn't know
I don't know
that.
why it's produced that night.
Wow, that's crazy.
Yeah, I don't know.
You think because maybe we relax now and our blood is just relaxing too and it's just building up or something?
Yeah, I don't know. And I really have a desire to know that. I don't know.
So that's why they do like fasting labs the next day to get, okay.
So I can see what their liver function is. A doctor may know though. He has to know because he's prescribing these medications. Why cholesterol produced at nighttime? I don't know that.
So we gotta eat our oatmeal and Cheerios at night?
Oh, that's something different. Okay? So, statin drugs, what they're gonna do? Stop the production of that extra cholesterol. Okay? So of course, I'm gonna monitor their liver. I'm gonna monitor their kidneys. Okay? I'm gonna monitor their liver. I'm gonna monitor their kidneys, and they're gonna take it at nighttime. Okay? We don't wanna use it a whole lot in kids because again, it's hard on the liver, it's hard on your kidneys. pregnancy and breastfeeding, don't use it. Older adults, okay? If they have no liver disease, okay. If they have no muscle pain, okay, all right? But anybody who already has liver issues, who has kidney issues, they shouldn't take a statin drug, okay? Now, y'all were talking about the Cheerios, okay? That falls under this class of medication. It's called bile acid sequestrants. Y'all know what the word sequester means? I don't know what it means.
Sounds like some aquatic type thing.
I never know what it means until they say like sequester a jury. I'm like, oh. What's
Like
what-
jams and stuff?
No, a jury, like
Oh,
a court.
Oh, okay.
When they sequester a jury for court, they're isolating them, they're sending them off somewhere by themselves. So this class of medication takes bile acid and it sends it off to the side, okay? But guess what loves bile acid? Cholesterol. So whenever the body sends the bile acid to the side, the cholesterol follows it and is eliminated through the stool, okay? So bile acid sequestrants like cholestyramine, Questran, those types of medications, how does it work? It separates the bile acid. When it separates it, cholesterol is just like salt and water. Cholesterol follows the bile acid. And so when the bile acid goes out through the stool, the excess cholesterol goes out through the stool.
Does it look a certain way?
Sometimes you may have like more fatty stools, depending on how much cholesterol, increased cholesterol you have. But in order for this medication to work, what needs to work on that patient?
The liver, kidney, what, the stomach?
What part of the stomach?
The G?
The intestines, the
Oh.
GI. They need to be able to poop,
Oh.
right? Because that's how cholesterol is gonna be eliminated. So with statin drugs, we're stopping the production. With these medications, we get rid of cholesterol. And it's getting rid of it through the stool. So they have to be able to have bowel movements. If they can't have bowel movements, can they get rid of the cholesterol?
No.
No, okay? We talked about Cheerios, oatmeal. Those foods do the exact same thing. They take the bile acid to the side, cholesterol follows it, and you poop more. So that's why they have those commercials, eat 100 Nut Cheerios, it's really good for your heart. Because it's sending the extra cholesterol out through the stool. You ever notice with oatmeal, you go to the bathroom more? Oatmeal, Cheerios, it helps you go to the bathroom more because it's getting rid of that excessive cholesterol. Make sense? But what has to work? GI. They have to be able to have a bowel movement. So as a nurse, what am I checking?
Your bowel movements.
Bowel movements, I'm asking about that, and also the bowel sounds. I need to check those bowel sounds, okay? If they're having issues with bowel movements, is this a good medication for them?
No.
No. Make sense? So, statin drugs are gonna stop the production of cholesterol. These medications, what is it gonna do to cholesterol? It's gonna set it to the side and get rid of it through the stool. Make sense? Questions? Now, when you're taking these medications, you may have to take extra vitamins, like vitamin A, D, C, and K. Okay? Because it's stopping fat, right? It's getting rid of fat. Some of these vitamins are called fat-soluble vitamins, so it needs fat to be absorbed. So if we get rid of excessive fat, can we absorb these vitamins? No, so we need to tell them to take extra vitamins. Make sense? It's always something, huh? Fixing something and we messing something
Look like
up.
we should take vitamins.
You just was
It's
on
coming
the
from burnout.
It is,
No.
I mean,
Yeah, that one.
and
OCD,
also,
yeah.
that's why we gotta take care of our bodies from the beginning, but we don't know in the beginning, we don't know to take care of our bodies, which is why we mess it up in the beginning. By the time we get, older, we're like, oh man, I wish I would've known that.
And I know in high school, God be sleep.
I'm saying,
Girl, you ain't me.
okay? Of course, we don't wanna give it within 2 hours of other oral medications, why not?
Cause of the stomach, GI.
Right, we're gonna be doing a whole lot of pooping, okay? If some of those medications may be fat soluble or lipid soluble, which means some medications may need that fat to be absorbed. And we're getting rid of a lot of that fat, right? We also gotta check for constipation, bloating, gas, cause what are we gonna be doing? We're gonna be going to the bathroom more. okay? But if they start getting bloated with no bowel movement, then that's a problem, right? If they're taking these medications with warfarin, which we just talked about, it may increase their risk of bleeding, okay?
So now we got poop in our stool.
Now we may have blood in our stool,
Right.
so we gotta monitor for the bleeding,
I can't, you just
okay?
take me in the woods and take me out.
Right? So you wanna take other drugs.
Bad heart, cholesterol.
You wanna take other drugs about 2 hours before or 6 hours after. Take it with a lot of water, because you gotta be pooping, right? It's easier to poop when we have more fluids, okay? We need to assess those bowel sounds. Make sure they can have a bowel movement, okay?
Let me tell you.
All right, y'all can take y'all 10 minutes.
I might need one.
You think that is.
Yeah,
I guess I'm gonna be drinking this weekend.
we ain't gonna be doing nothing. We eat oatmeal.
I don't think I have cholesterol, I was gonna be one. They don't check, so I was trying to take it Thursday.
No, wait, so check your cholesterol levels.
All I was trying to do was not run on that, I just called it in.
That's what I was like,
They don't-
wait a minute.
No, that's a problem.
I just looked at the schedule, I'm like, you don't say nothing on the test on
Dr.
Thursday.
Thyssen, how much we gonna have on the census? We have a whole bunch of,
I
At
said,
the end of the day,
It's still the same medications over and over again.
whole weekend gone.
So one question may cover like 3 chapters.
look, I got the level up RN thing or whatever. Somebody had gave it to me for pharmacology. And the cardiac drug is like the thickest one. And I was like, oh, okay. And they be having like little snippets on it or whatever to help you, go through it too, or whatever. It's a lot.
It's really
It's
hard.
interesting, yeah.
My
you
husband
learn.
went to the doctor, he has, something wrong with his disc, and he has some, his son died for writing and something. I'm not, my teacher said you can't take that, you gotta wait because, you know, you're like, oh, you're smart. I'm like,
Oh.
Yeah, it's interesting
It
because
is.
you're learning.
I'm glad you know I ain't gotta take this medicine.
Now, anybody said that.
No,
My
well,
sister
there
said-
She
did.
said, nobody said that.
She said no more.
No more. Discontinue.
What you gonna be, what you gonna do at the, Deja?
When?
You gonna be drinking anymore?
I can't drink this weekend,
Why not?
cause I gotta do all this.
We got to study, Mom. We got a week to know all this stuff.
Mm-mm.
We ain't.
Study
You
first.
should know half of it though.
Mm.
Yeah.
I can't take Adderall and name drink, so I gotta pick one.
Girl,
So I'm gonna have to take the Adderall.
we still doing dosage, huh?
And we
Thursday.
get mad. Like what? I ain't gonna be doing nothing this weekend.
I swear to God, if I don't pay.
I might as well cancel my
I ain't-
plans. I
coming
got
up
You
here.
not like you told
I
me.
ain't coming in here.
No.
Like I'm trying to sweat it over.
Oh, what day we got a test? We got to come in here the day after that. I mean that night
Say it
of
again.
that test. Wait,
Got the test Tuesday.
on the 18th, and then we got class after that. It ain't gonna happen for me. I'm
Bring the wine, Dave. Bring the
just send me,
wine.
just y'all record. I know after that test, I'm probably be crying.
Right.
It just seemed like so much. All them chapters.
I don't know, but y'all came in knowing the stuff already.
But
I
teach,
can only imagine
you
what
know
the
when you
finals
get in
gonna
front of
be
that
like.
screen, you just go blank.
You get nervous, you get nervous.
Well, first we gotta find the right screen.
Maybe you forget everything you learned.
And Potter coming there like you're cranky. Like, she looking at me sideways. Put the screen on, chick. See, when you went in, we had to have her. Don't do that no more.
I'm sorry.
Don't do that.
I
No more.
record.
I know, Mom. But look, just cancel us. Cancel us. We can do it at home. We ain't gonna cheat. If nutrition got us, she swear to God, we good, I guess. She just trusts us with all that shit.
But she had so much going on, she a first lady. She got a lot going on.
And baby, look, I ain't complaining.
Me either.
Cause I needed an easy
like
test to
me.
go with this. I
You
couldn't
twist.
imagine having had her in. No.
And I said, her thing really must not be mine. Because I looked to the.
I'm just trying to hold on to my little 2 little points to keep me to pass.
I got an A in that class.
Baby, I got a B.
I had to make it look a little good. I wasn't going to
I
hundred.
don't even much care. I be too focused on this. I be like,
Right.
That's what I be focused
I don't care.
I gotta be there. I'm happy to be there.
I gotta be me too. I'll be happy with an 80. I don't care.
Cause that's the rest of our work.
That's it.
That's it, right?
She gonna get all that.
We done saw that chick one time, y'all.
I ain't see her then, cause I couldn't get on the.
You was on there,
I got on there for 2 seconds.
Well, you saw the bro.
No, I clicked my screen off. I was driving. No, I think I was doing lashes.
Oh, she's a, no, you was driving.
I was driving.
You
yeah.
was driving.
I was like, I was
Ooh,
in
yeah.
I was
Looking
doing
down and looking
lashes.
at the road. One time, she let us know, yon, and clicked on. It was
Y'all saw those classes in August? It looked like one of those was a hybrid class or something.
What?
One of them.
What, when our classes? I'm gonna go home tonight and see if I can get
But
it.
y'all see that we take a class at 1 o'clock?
No, if you have the option, that's what I'm saying, we need to get in those classes, cause you have, that same class, you have the option to take at like 1 o'clock or like 3 or
I
something.
honestly don't think that we should have to register. Just
Me
put
either,
us
just
in the
put us in
daggone
there.
class. What's
That's how I
that thing?
I agree.
Do you have
Well,
a
y'all know we gotta
charger?
Cause Dr. Dyson, they want us in this honorary program. We cool with it. But we have to do so much to get in to where they don't have it all the way together all the time.
No, I
That's what
wasn't.
we saying. Like, we gotta register for class, and we can't get into register for class.
They didn't let me.
I'm gonna go on tonight.
You make sure that it didn't say, like, you went back on there and saw that it's on your okay. I busted, cause I thought mine was doing it too, and then I went on there, it was like, no schedule, and it says an error.
I still gotta do that other little thing we have to do. Like, upload all our information.
You ain't did your view? See? We had a deadline.
She's like, oh, that's to make sure you have one.
But I couldn't say,
Yeah, she can answer that.
We gotta have you for a clinical. All the what viewpoint?
that's the one that comes to me.
No, I guess we go here from 1 o'clock.
Yeah, 1 o'clock to 2:30.
So 8 o'clock or something, cause you have personal nurse perspectives and skills at 45, to 7.
Yeah,
This is
schedule
skills,
for-
a theory and a lab. We're here from 1 o'clock to 8 o'clock. I mean,
Well, you better bring breakfast, what
that's what
you
I'm
do.
saying, and some people have people that's on Thursdays.
That's what I was saying, I think it's.
That 1 o'clock might be
Wait, hold on. It's my Apple Watch. My Apple Watch just. Oh wait, I did, because last time I didn't bring it in, and I was like, I'm bringing it this time.
It's probably gonna be the same way like these, $100, the jacket and the top and pants is probably. But you know the lady probably are gonna just say, I'm trying to give you one.
No, I want two uniforms that time. I celebrate.
I did.
with them outside.
Well, I didn't.
I'm fine with those, because one ain't gonna be enough. Cause you gonna need it for the rest of the program, so.
The gray one?
Yeah.
Well,
Yep. Oh, you still got one? Alright, so there's one medication that you can use for cholesterol, it's extremely expensive,
what it is?
okay? This is Zetia.
Mm-hmm.
This is a medication you usually get put on when nothing else has been working. So when you took statins and it didn't work, and when you was on a low-fat diet and it didn't work, this medication is what they usually put them on.
What is it called, Dr. Knight?
It's called Zedia,
Zedia? Oh, there you go.
okay? Yeah, the only thing I want you to know about that one is that's usually the last resort. When the statins aren't working, when, the low-fat diet and stuff isn't working, okay? And one of the rare adverse effects is angioedema again, okay? But again, this is usually like the last resort. Nothing else has worked.
That means you gonna be really close.
It's a little stronger.
Some of our patients are still on a statin and then they'll add Zetia sometimes.
Sometimes they will.
They'll combine it, or if they can't tolerate the statins, they'll just put them on those.
Well, they don't know that.
Or
They
there's
just
that
use
new
it
pen
like
injector, what is it called?
They see it.
There's a new pen, like there's a pen
They don't
injector
know.
that helps with high statins that a lot of people are trying to get instead of, it's like a pen needle that you give yourself to help lower your cholesterol. I forgot what it's called.
It's new.
Mhm. Yeah, but you have to try and fail all the formulary drugs prior to that one.
You gotta try and fail them.
You gotta do that PA.
Alright, so fibrates can also be used to lower cholesterol. Okay, it's actually gonna break down the fats. Okay, so fibrates are actually going to break down fats. Okay. So you're gonna have some mild stomach upset, diarrhea. Okay. And if you notice, anything that lowers your cholesterol can cause warfarin to be toxic and cause you to bleed. So if they're on both of those, you gotta really monitor for bleeding. Okay, anytime they take anything for cholesterol, or they're taking like an anticoagulant, you have to monitor for bleeding. Okay? So fibrates, they kind of break down those fats and cause stomach upset and diarrhea. Alright? And then there's vitamin B. I know y'all heard of vitamin B before, right? They got all different types of vitamin B, but this is like niacin or nicotinic acid type of vitamin B.
We just went over this in nutrition in one of the chapters.
Oh, y'all
So
agree?
this vitamin.
That's a whole thing.
Look at I'm pointing at you. You answer.
Oh Lord, I can't with y'all.
So it should be a little easier for y'all.
They go hand in hand.
Oh my
Alright, so
God.
vitamin B.
They
So
yelling crazy.
vitamin B, that's niacin and nicotinic acid. You can get that over the counter. That helps cholesterol. But people usually complain about the side effects. Itching, flushing, okay? So you can take like ibuprofen or something about 30 minutes before, and that'll decrease those
Oh my
side
God,
effects.
not Tylenol?
It's an NSAID. Okay? So it's a regular B, vitamin B, so it's niacin or nicotinic acid.
For fibrates?
No, fibrates is something different.
Okay.
It's another.
Right, this is just a vitamin, vitamin B.
Oh,
So niacin and nicotinic acid can be used for cholesterol. The major thing to know is that it can cause itching and flushing. Okay, you can tell the patient the longer you take it, the less, it'll be. Or you can tell them to take an NSAID about 30 minutes before they take this vitamin. Okay? You don't necessarily have to have a prescription for it because it's a vitamin that you can get over the counter. Okay? I'm not talking about like B12 though. I'm talking about regular plain old vitamin B that y'all learn about in nutrition.
So the NSAID will help with the itching and flushing?
Yes.
Yeah.
Yep. Because what happens with this vitamin is gonna cause some inflammation. That inflammation is what causes like the itching and flushing. So the NSAID is gonna stop the inflammation. Okay? That's the main thing with niacin. Questions?
That was more than enough.
It's not as bad as what y'all think.
You always say that, Dr. Thyssen.
go into convulsion.
Look at the questions, like, y'all missed the easy, y'all not missing the hard stuff.
I know.
Yeah, but you don't ask it the way you be asking in class, man. We gotta sit there and concentrate.
Like I said,
Alright.
I'm not gonna say, I'm not, no, it's chapter 20. But y'all, guess what? We kinda talked about the medications in chapter 20 already, right? What are those medications?
Vitamin K.
Vitamin K, what else?
Warfarin.
Warfarin,
Warfarin,
heparin, okay? So these are medications that affect blood clots. So y'all can kinda tell me about that, right?
A little bit.
Anticoagulants, what's gonna happen? It's gonna prevent your body from clotting, or your blood from clotting. Is it gonna break down the clot that you have right now? No. It's going to prevent future clots.
So what we gonna do with that one?
So,
Prevent it from getting worse, right?
if it's getting worse, if somebody had a heart attack before, they probably had a blood clot that caused a heart attack. So after that heart attack, they're gonna be on anticoagulants. Somebody who has AFib, that means their heart's doing this. It's not really pushing out blood anywhere, the heart's just sitting there, they're at risk of blood clots, right? So I'm gonna give them an anticoagulant. Somebody who has heart failure, they may be on an anticoagulant. Anybody who is at risk for for blood clots is gonna be on an anticoagulant. Somebody who's on bed rest is gonna be on an anticoagulant. People in the hospital, so they in the hospital, they're not moving around, they're gonna be on Lovenox. Lovenox is heparin. Heparin is anticoagulant.
Why they put it in their belly?
Because that's where it's absorbed the best. Alright? But speaking of giving Lovenox or heparin in the belly, we do not give it near a surgical incision, because what's gonna happen to that incision?
Clot the incision?
It's gonna start bleeding.
Oh.
We don't give it right next to the belly button. Why not? You may develop an hematoma. Okay? So we wanna rotate the site, but not near an incision and not near the belly button. Okay?
So what would cause the hematoma by the belly button?
Think about when you're born, okay? And they have like the umbilical cord. Before it falls off, there's like blood vessels right there, right?
Okay.
So the belly button is just a scar. Everybody has at least one scar, that's the belly button. So behind that scar,
I don't have one anymore.
it's there.
They
If
cut
it's
it
an
out.
innie or an outie, it's a scar there. Cause there used to be a hole, so it's a scar. Alright?
My surgeon cut
So
it
there's
out.
blood vessels back there, okay?
He did.
So it can cause like the
Bastard.
hematoma. Alright?
Dr. Thyssen, if I have a blood clot and I have the heart attack, does the blood clot go away
No.
after that?
No, that's a whole nother medication that we don't cover in this chapter.
Okay.
Okay? Any questions about Coumadin or warfarin? We talked about that already, right?
Right.
What can they not have? We don't want them to have a whole lot of vitamin K.
And
What is vitamin K found in?
leafy.
Green leafy vegetables. But if they overdose on warfarin, what am I going to give them? Vitamin K. If they overdose on heparin, what am I going to give them? Chlorine sulfate. Okay? Do I need to go over those two again?
No.
Alright, so again, when I talked about the different, labs that you draw, that's all in here as well. Like the APTT, the PT and INR, that's in there, alright? I'm going to go to, like you said, with, somebody who has a heart attack. That may, this is, somebody who had warfarin-induced necrosis, which means they were getting so much Coumadin that they started to develop a hematoma, and that hematoma turned necrotic. So that's just some stuff we gotta watch for, alright? But if somebody has a blood clot right now, let's skip into this. If somebody has a blood clot right now, or they have a heart attack right now, they have a stroke right now, I want to do what to that blood clot? I want to get rid of it, right? I want to break it up. So I give them thrombolytics. Thrombo means blood clot, lytic means to tear
Release.
apart, okay? So I'm tearing apart a clot that they have right now, okay? So these are our ACE drugs, okay? So alteplase, retalplase, uricanase.
God bless you.
Thank you. All those ACE drugs, those are clot busters or thrombolytics. somebody's having a heart attack right now, are they gonna get alteplase, or are they gonna get warfarin? Alteplase, cause I need to break down that clock right now,
And warfarin after.
and warfarin after.
So we ain't gotta do this no more.
Correct.
So hopefully you don't have no more blood.
But guess what, the side effect for both of them are the same, right? What's the side effects? Bleeding, okay? The main thing about these thrombolytic drugs, those ACE drugs, when are they gonna get it? When they have a blood clot right now. So if somebody got a DVT, they got a blood clot in their calf, which medication are they gonna get?
The place.
An ACE, a place, thrombolytic, because I need to break down that blood clot now. Okay? If somebody has a pulmonary embolism, what are they gonna get? The ACE, because they got a blood clot in their lungs. I need to break it down now. Okay? Make sense? Questions? I don't have to talk about the side effects because they're the same as everything else. What's the side effects? Bleeding. What's the nurse gonna do about the bleeding?
Get an
Monitor it, education, teaching them the signs of bleeding. Again, the patient says, I got blood in my urine. Is that a problem?
Yes.
Yes. Okay? All right, I'm gonna go back to antiplatelets. So antiplatelets work very similarly to anticoagulants. It's going to prevent blood clots, but it's not preventing it the same way that anticoagulants are. What antiplatelets do is it stops the platelets from sticking together. Y'all know how you have platelets and it forms a platelet plug to make a clot? So antiplatelets stop platelets from sticking together. Antiplatelets are things like aspirin and Plavix.
I hate that commercial.
Okay, so again, it's used to prevent clots. So if somebody's taking a baby aspirin every day, are they taking it for pain?
No.
Why are they taking it? Baby clots.
My boss told me.
Because your boss told you to?
And I'm saying my doctor, the OB, told me I'm supposed to be taking baby aspirin every day. Cause I'm geriatric.
See how they do it? So that means sometimes we have increased blood pressure, we are at risk for developing clots too. Okay? So antiplatelets are medications like aspirin and Plavix. Now the good thing about antiplatelets, I don't have to check like certain bleeding times, like I do with anticoagulants. But what's something big about aspirin?
It would be hard on MGI.
Okay, that, and what else? Who can have aspirin?
Children.
Children. All right, what else with aspirin? Toxic.
Oh, yeah.
Okay, how do I know somebody's toxic?
Bring it in.
Bring it in the ears.
Like it's a certain age with kids.
So usually they say kids like under 12, but it really just depends on like, cause they got some really big kids now.
Sure.
They have some kids who just.
Don't even look like they kids.
So my mom gave my little girl a baby aspirin one day, well, last week, cause she had a fever, and she didn't have, the Motrin was at my house, and I was at work. So she said, well, I gave her aspirin. I said, you did what?
How old is she?
I said, don't give her no more.
How old is she?
Nia is 8, but she a thickin'. She big fine like her mom.
So you just gotta be careful, cause sometimes it just happen like that.
She said, she's like, Mom, I'm hot. She said, I'm just so hot, Mom. So I'm guessing she had a fever. Oh, and Mama said, well, I gave her baby aspirin. I said, don't give her no more. I said, why? Why I can't give it to her? I said, you trying to kill my baby. So what is Reye's disease? What does that do?
It has like flu-like symptoms, and it really kind of messes with like their cognitive development, and it can be deadly.
Well, she's straight, she on print, huh?
So, people who are getting antiplatelets, we gotta check for aspirin allergies and if they're allergic to NSAIDs. Why? Because aspirin is very similar to NSAIDs, okay? And they already have GI ulcers, do I want them to have like aspirin?
No.
No, because they may start bleeding, okay? All right, questions about antiplatelets? It's very, go ahead.
I just wanna know why is that color like that yellow color?
What color?
The platelets. Like we gave platelets one day, and I guess it's because the bag was in, and they were giving it and not
it platelets or plasma?
That's black.
It's not plasma.
It's not that plasma? Yeah, that is.
Right, questions? What's the side effects gonna be?
Bleeding.
Bleeding. Okay,
And it's to prevent, right?
prevent. Everything is to prevent except for thrombolytics, that's gonna break it down right then. Okay? Questions? All right, y'all ever heard of hemophilia?
Yes.
I used to think that was something made up until, cause I was like, he was bleeding for no reason.
Mm-hmm.
Until I had a patient who was missing some factors. And you have like different factors in your blood that help you to clot. And they were missing some factors, so they couldn't play rough, they couldn't play any contact sports because any injury could possibly cause internal bleeding.
Yep.
Okay? So we have to give them, colony stimulating factors, okay? So we had to give them the factors that they were missing to help them to clot, okay? So those hemophiliacs and those who are missing those factors that they need to clot, we have to give them medications that will help them to clot. But guess what the side effect is?
The stomach.
Not bleeding.
Blood
Not
clots.
only blood clots.
Oh, come on
It can
now.
possibly be blood clots.
This is too much.
So we gotta really watch it. Okay, do I want them to keep bleeding?
No, but I don't want
them
the
to
clot
clot.
either.
But I don't want them to clot too much.
So it would have to be a certain amount that they can have.
We gotta monitor their bleeding times.
So they always get labs drawn. Dang. It sucks. This life.
Sometimes, you ever heard of somebody having like thick blood?
Mm-hmm.
It's not necessarily that it's thick. It's,
It just
like,
clot faster.
it clots faster, it may have more red blood cells that makes it, like, give it like more thicker appearance. But that also puts them at risk for what?
Blood
Blood
clot.
clots.
Blood clots. Okay? So sometimes when we give them these extra factors, it's gonna make their blood thicker. Okay? And what you got?
I have a question. My sister said that she have to use a certain type of tube for her blood on it. It's gonna clot. Is that?
So, there are certain labs where, so not every lab drawer is supposed to be with the same size needle. Okay, if I'm drawing a CBC, that's a complete blood count. That means I wanna pull the blood cells, right? I want a bigger needle. Because if I use a small needle, this is gonna happen to those blood cells. They're gonna tear apart, and it's gonna hemolyze, and you can't do nothing with them, all right? Certain labs require a certain size needle. So if she's always getting a certain lab, then of course, yes, she's gonna need a certain size needle. Okay, but y'all should learn that when y'all get to y'all med-surg class, not every lab drawer gets the same size needle.
No, I didn't know that.
Yeah, because if you use like a needle that's too small, you're gonna rip them red blood cells
So
up.
that's why the lady told me I can't have the butterfly needles.
Now, here's the thing though, butterfly needles come in different sizes.
Oh.
People don't realize that they
I'm
come in
like,
different sizes.
when I first, I hate getting my blood drawn, period, for anything. And I used to be like, can I just get a butterfly needle? And the lady would be like, no.
And so butterfly has nothing to do with the patient and everything for the nurse who's using it.
I just thought
just
it was
makes
smaller.
easier. Yeah, it just makes it easier.
That's all. I think it was a mental thing.
It is a mental
That's
thing.
all.
So when you draw blood for the heparin and warfarin to check the levels, it's a certain type of tool you have to use for that too. You gotta use it.
It's a certain type of tube for all of them, because they have like different minerals in the tube, they have, it's a whole science behind all of that.
That's too
Yeah,
much.
but y'all should learn that in your med-surg class.
I don't want to be a nurse no more.
She signed up for it.
You did, T? Girl, don't make me cry.
She signed up for what?
Yeah,
She
Did she?
You signed up for what?
Baby, you going on and get started.
Wait, hold on, what y'all said?
You signed up for med-surg?
Oh, cause I baby, I was about to say, I need her.
I saw your
Oh, maybe
But you only teach this and somebody else.
Remember the first week she had said she was gonna think about it?
Well, they already probably got the teacher set up already.
And she put me in pharmacology.
But you only gonna teach pharmacology and so.
She just did.
That's
One
all
thing you had said you was gonna think about.
No, you had, oh,
I'm serious.
That's how we teach you.
She was at the health fair. But you know, we
You was in there when happened at the health fair, they said that's gonna be out there. You was in there?
No.
Who was in there?
The little older lady, she was sweet.
When she told New Brown,
She was sweet. The little older lady.
You talking about when she walked up to us?
yeah, when she walked up to us, when she walked up to, I ain't gonna call no name that person, and she did what she did, and I was like,
She ain't sweet.
Well, I just know her from the lake.
What's her name?
Anastasia.
Anastasia.
Oh, that ain't who I'm talking about, cause I met another lady, she was an older lady, an older black lady.
I know Anastasia, I know Anastasia, I'm
Yeah.
talking about med surg. I'm talking about Tommy.
Oh, you talking about Anastasia.
You gonna look into it?
Oh, okay, I'm like, wait.
Asia's was the shorter one.
Dr. Thyssen sitting up there just lying.
I haven't been in the hospital in years.
But she got that PhD in this here.
Right there.
So
That makes
that's
it
why they gonna keep
right there.
That's the dope girl. Let me go manifest this. She is gonna manifest you, Dr. Thyssen, being a med surgeon. They probably already got it.
A lot of my friends teach here already. Like Miss Arnold teaches here.
The queer is already on our class semester, so y'all can get that out the door.
She's our teacher?
Name your friend.
Oh, that's what I was asking.
The queer is already.
Med surgeon
It's
teacher.
great teachers.
I'm ready for a B. I'm ready for a big break.
Wait, she's our med surg teacher?
I ain't
She
worried
does
about
med surge one. She did med surge one last semester.
But wait, but what you was
The
saying?
queer.
We ain't talking about your friend.
Oh, I was saying that if I had hemophilia,
No, I ain't talking about that. You're trying to change the subject.
no, that's not what I was gonna ask y'all questions.
Oh, okay, come on.
You were saying you don't know if you
Why does it
qualified.
like
Just-
truly?
yeah.
Oh, I have
You
y'all.
took this in, cause that
So,
damn
You
thing
said
ain't
you
working.
gotta look at the time.
We
at
have
the
got all
time,
those other
then
pictures.
So what y'all got to go outside and be like,
teach med surg, you gotta go to
let me
clinic.
look at
Like I gotta
the
teach
photos.
Probably so,
And
yeah.
see, here's the thing.
How
It
old?
don't be
19.
going, like, what time y'all gotta get to clinical?
We gonna be in the morning, 6 in the morning. She
I gotta
gets
get my
there.
kids to school for 8 o'clock.
We gonna hold that.
It's on
We
weekends.
gonna hold that. It's on Saturdays.
It's on weekends?
Saturdays.
It's on Thursday.
Wait. In the fall?
In the
I
fall, we
mean,
go.
it's football
That's
season.
7 weeks. 7 weeks.
It's football
You a
season.
saint? I mean, if
Dr.
you got
Tyson,
this-
we gotta make the death.
Why you call her Dr. Tyson? Tyson, just tell her what age it is.
What I said, Tyson or Tyson?
She said Dr. Tyson.
Wait, no, I said
She
Tyson.
be saying Tyson, girl.
Go back to sleep.
Don't worry about it, Dr. Dyson. We understand, cause we don't wanna do it either.
I think
Oh, man. Stick with what you know.
oh, man.
It's too late, it's already set. It's already
I will be there late, and I want y'all to talk about my team, right? We come on time.
Baby.
I know how y'all get.
No, oh no, we
You
love
way
you.
better than
Oh no,
Don't even
no,
worry
no,
about
you
that.
teach us. You can show up late, cause we still gonna learn.
And what you gonna say is, well, she show up late.
Nah,
Nah. See, I knew I should have just not said nothing. That don't play for everybody, baby. I'm serious.
Alright. Any questions about any of this stuff? Is it hard?
No.
No.
It's just a lot.
Don't make it harder than what it is. It's not. Adenosine, what's the only thing you need to know?
I didn't.
Oh, that's the heart stop medicine.
It's the rebooter.
Y'all, don't read all that extra, especially chapter 18, because what did I tell you?
We only got one question.
When you teach it in med surg.
Liam gonna get you the man serious.
See that, huh?
Look,
All
one
right,
way
so
or the
y'all,
other.
Next class is gonna be virtual. We're going over just one chapter, respiratory medication. Y'all, I'm telling you, I hate teaching respiratory because I hate talking about snot.
But I can't do music, so that's my only thing in there, and I hate it.
Snot, because a lot of the respiratory medication,
That's all it is.
You know what I hate doing? The sputum coaches.
that's nasty.
Boy, let me tell you something.
Who doing that?
Whenever the patient, when we have to collect
That's
them,
what the nurses get paid for.
So Thursday, we're going over chapter 21. It is virtual, and we're going over dosage.
Will that be on our test for Monday too?
say?
That chapter, will it be on our test for Monday too?
Monday.
Thursday, we going
Uh,
I mean Tuesday.
Yes.
Wait, check so.
Just follow the schedule. Don't listen to me.
But again,
It's not that much coming out of all of us, so
no, it's not, and think about it, what we did last week, we also covered again this week. It was the exact same classes that we covered.
Well,
So,
Lord, I better
It's
get
50
Let me
questions?
take a picture.
Yeah, I know it's 50 questions.
unless y'all want more.
No,
ma'am, I'm
no.
taking classes.
Matter of fact, you can go down a few.
We still waiting on that paper.
Yeah, that's what I mean, that's what I'm saying.
All right, y'all, so as far as ATI, remember ATI was supposed to be a part of your grant. So I talked to, Dr. Potter and I talked to y'all, and it doesn't seem like y'all have y'all, logins yet, so I can't really assign, and I don't want it to be like a last minute thing. So if you notice on the schedule,
I need that 5%.
y'all, do y'all look at the schedule?
Yes. Just got a little confused, that's all.
Okay, no, it's no worries, cause I should've changed that from first. All right, so the 18th we're going over, that's our exam 5 already. It's cardiac drugs and respiratory drugs in some dosage, all right? And then all we have left is like those neuro drugs, that's like those antipsychotics, things for depression, anxiety, and those are common medications, right? Very common medications. And then also GI medications, which are common medications, like medications for nausea, vomiting. What's wrong?
No, I'm just, when you mentioned doses, so are we gonna go over doses this Thursday?
Yes.
Yes. Yes, because we're only going over one chapter and then the rest of it's gonna be dosed.
Okay.
All right, so I have down here group presentations. That's gonna take the place of ATI if y'all never get your ATI.
I hope we don't get it. I'm just like, cause it's last minute, we should've been got that.
So, for group presentations, remember there was a chapter that I left off, right?
What was that?
Eye medications. Eye medications are very easy. So what we're gonna do, that class, I'm gonna have it set up like, you're gonna be doing a teaching plan for a patient. Okay, so you're gonna get in your groups, and then y'all can choose whatever group you're in. But you're gonna get an eye medication, you're just gonna develop like a teaching plan, how you would teach a patient about this particular medication. Does that make sense? And that'll go towards y'all ATI grade. Okay, does that make sense?
Nope.
So she said we're not gonna get along.
No.
So the last time I talked to her, she still had,
That's gonna be our final.
no, it's not, I need to figure out what your final, do y'all have a list of, the final exam dates?
No, you have two BAs.
They just said the 26th and 27th.
They
But
usually
they
tell
haven't
the
given us
professor
time
when
to-
it's gonna be.
Oh,
They don't tell us.
We can do it at
You
home.
will wind up telling us, but they're gonna say, hey, this is when.
okay, so I don't have that yet.
Are we gonna do a final exam review with you?
Yes,
Okay.
It's gonna be a real review and not just,
yes,
okay.
so,
The only stuff we need to.
I'm gonna need to see the question. Throw two on there for me.
right, so the day that we have these group presentations, because that's not gonna take long, y'all talk about how you teach about eye medication. All right, and we'll use that day for a final exam review, okay? And then I'll have specific medication classes that I want you to know for the exam. Okay,
Sweet baby Jesus.
questions? However, if she happens to produce like the, ATI login,
Girl, we ain't got the drug book shit.
she has them.
Well, we ain't got them. We got
For
them.
all this dope, and we ain't got a drug book. We probably could have been passing it.
All right.
Yeah, we almost done.